And I just want to say that it's an honor and a privilege to be presenting to you all today. When I have students in my office that I precept, I actually learn so much from them, and I hope that they learn from me too. I've been an RN for 38 years. The last 18 I've spent in school nursing. And as Jody mentioned, when you're working in your other fields of nursing, they're all rewarding in their own way. But I think that I truly found my calling when I switched over to school nursing. You are able to impact so many lives, and this is really our last opportunity to make a difference in the lives of our future. And it is very rewarding in so many ways. Some days, you know, I go home and I cry and I'm like, gosh, I hope I made a difference in one person's life today. And sometimes we never know if we did or didn't. And other times we have students that come in and see us all the time, or come in after they graduate and they say, hi, miss, remember me? And I remember when you said this or did that. And to me, that's what really makes this job rewarding. We're dealing with, for the most part, a healthy population that we can do preventative things, you know, education with, versus when we're in the hospital setting and we're dealing with secondary or tertiary issues with our patients. So hopefully we are making such a difference with these students that we will have a next generation that will be a little bit healthier, will at least know what the ramifications are of their choices that they're making. So what I'm going to discuss today, just really very briefly, because I could stand here and talk to you all day, is the role of the school nurse. And we have a huge role. We don't sit in our office and drink lattes and read the paper and then put a Band-Aid on. Not in this district anyway. We work, I think, very hard, and we literally case manage just about every student that we see. And we have to make sure that every student that we see is educated to some degree on what it is we're hoping that they gain out of the experience. So it is, as Dr. Disney said, it's a very specialized practice of nursing. We have to have our nursing license just like you do. In order to work in this district, we must have a bachelor's degree. Although some districts kind of waver with that a little bit, and they'll accept associate degree nurses. I think that we have one in our district. And we either need certification or should have certification at the state level or the national level. Dr. Disney and I have it at the national level, right? We're nationally certified school nurses, just like a teacher could be nationally certified, or you can be certified in wound care or certified ER nurse. You know, we also are certified by the same organization that certifies all those other specialty practices. If you choose school nursing, you actually have to have a basic knowledge of pediatric nursing, public health nursing. You have to have good assessment skills. You need to be aware of or familiar with the laws that impact students in the schools, because they're a little different than some of the laws that you deal with. We deal with HIPAA, just like all other areas of medicine, and we also deal with FERPA. We deal with Americans with Disability Acts, and there's many other things that we have to deal with in the school setting that you might not have to in other settings. We also need to have developed a little bank of teaching strategies. So how many of you think that you're teachers? Okay, how many of you have read your State Nurse Practice Act? Ooh, every hand should go up here. Read it again, and you will find that the Nurse Practice Act states that one of your roles is as an educator. So how many of you are teachers now? We're all teachers. So Our primary role as a school nurse is to support learning. And by that, I mean that healthy kids are healthy learners. And so it's our role to keep the students in school. My role is not to send all these kids home. My role is to figure out how can I keep this student in school learning and learning at their optimum potential. If there's something going on that I need to refer them out for in order to get them back at their optimum, then that's what I need to do. You all have probably all heard of coordinated health services. Have you, in any of your lectures, coordinated health services? The CDC has a huge piece on coordinated health services. Coordinated health services involve all of the items that are listed up here on the PowerPoint. And we actually play a role in every one. And I'm just going to briefly go over how we play that role, looking at each one individually. So health services, we serve as the coordinator of the health services program, and we provide nursing care. I am the only medical person on my campus. There's no one else. I have a health assistant, and occasionally I have another RN there. The population that I serve is around 2,400 students and faculty. So I have a lot of responsibility at the school that I'm at, and we have a lot of special needs students, and it's my job to make sure that the services are being rendered even outside of my office the way that they need to be. So if I have to go into a special needs classroom and do some observing or see how they're cleaning things, how often are they changing their gloves, doing all these things, I have to make sure that those things are happening the way that they're supposed to happen. Health education. I love teaching, and health education is one of the roles that is a very significant component of being not only a nurse, but a school nurse. And I always say every moment is a teachable moment, and you have to take advantage of that. If you choose to work in a setting outside of school nursing, let's say you go into the hospital, you're going to be doing a lot of patient teaching in there. And the same happens with us. I might only see this student one time when I'm doing a drug assessment on them, but I'm going to take that opportunity to hopefully teach them something. Maybe if it's just about the choices they're making and how they might impact whatever it is they choose to do in the future. We are responsible for making sure that the environment is healthy, and that could range anything from seeing an overhang outside the school that looks like it's about to collapse and reporting that. One time I had a student that came in to see me, and he was doing some exercises in PE on what they called a box. And he had a gash down to his bone in his shin. And I'm like, how did you get this? And he said, I was on the box and I slipped. Well, I didn't know what the box was, so I had to find that out. Within a 2-week period, I had 2 more students. The box is now gone. Okay, because we need to make sure that whatever it is they're doing, it's safe for them to do. And that's just part of a healthy environment that we have. If we see something in a classroom or you know, even in our own office that we think is not safe. I had some corners on a desk unit in my office that when students came in, I thought were not safe, and they definitely weren't safe to me because I gashed my arm on it. So I went out and bought, you know, little baby corner bumpers for that. So now I feel good about that and know that that piece is safe. We want our students to feel safe. We're providing, our office provides sometimes the only place that a student will feel safe. They can come talk to us. We typically don't discipline them. We don't give them a grade. We want them to feel safe coming to us. Nutritional services, this is something that I think I love about our district is that we've really been working on improving the quality of nutrition to our students. Most of our kids here get free breakfast. Most of our kids are on free or reduced lunch. So we want to make sure that what they're being offered is healthy for them. We can't cut out the vending machine totally, but in some instances we've been able to impact what actually goes into that or what comes out of it. Physical education activity. We want our kids up and moving. We have a fairly high diabetes rate in our district, and we have a fairly high obesity rate in our district. And so one of our roles is to try to encourage students to be active. And one of the ways we do that is by being a good role model. So I don't sit there and drink Coke and eat fries in front of my kids and then tell them, don't do this. We also encourage the school to participate in other programs, like the NFL program, Play Gear 60, Fuel Up to Play. Fuel Up to Play is a huge, we push that a lot in the middle schools and elementary schools. The other thing that this district is very fortunate to have is we actually have wellness coaches for the staff. And there's all kinds of wellness activities that happen for staff members and for students. Counseling and mental health. This is the area that I really hold near and dear to my heart. We sometimes will do more counseling than anyone else in the entire school. The counselors in the school districts, more often than not, are educational counselors, which means they help the students get ready for college. They help them decide what classes they need to take in high school so that when they're ready to go to college, they're better prepared when they go there. We do a lot of the counseling and get into the nitty-gritty sometimes of what is going on with the student. And I'll just give you an example. I had a student a couple of days ago that was brought to me for a drug screen. She'd been smoking marijuana, but when we came down to really what was going on with her, her mother had passed away a couple of months ago, and I don't really think that she had dealt, well, obviously she has not dealt with that yet. And so the school, of course, is going to discipline her for what she did, but I made sure that the administrators also knew that we needed to work with her family to get her into some kind of counseling and outside of the school so that she could work through her feelings of the loss of her mother. And more than likely, the father needed the same thing. So hopefully we're going to make a difference in this girl's life. Parent and community involvement. We can't do what we do without involving the parents of our students or our community. And when I say this, I mean, we're working with someone else's children. And we need to never forget that. And even when you go out and work in whatever fields that you work in, you need to be cognizant of that, because these individuals that you are impacting belong to somebody. And we need to make sure that how we treat them is the way that we would want ourselves or our own children treated. And yes, we get tired, and yes, we get really busy, but these children aren't ours. And we need to love them in a way that is different than their parents would, but let them know that, you know, we're here to help. And we're going to call your parents if we need to. And we're going to involve the community if we need to. And when I say that, I mean, you know, using the resources that we have provided to us to help you be successful here in school. Staff wellness, also a part of what we do. At the beginning of the year, I always let the staff know they're welcome to come see me if they have questions or concerns, not only about a student, but about their health and wellness. And if I can direct them, you know, to the services that they need, fine. Sometimes they just want to come sit and talk, and that's fine too. And We need our staff there, just like we need all of our nursing staff present, because if they're not there, who's going to take care of the kids? Who's going to teach the kids? So it's important that we all take care of ourselves. And that'll include you too. Sometimes caregivers are the worst people at taking care of themselves. And you need to be sure that you take time out to do that for yourself. So we provide a myriad of services. We triage just like you triage in any setting. We treat illness, injury. Sometimes I look at my office as being like a little urgent care. We just sometimes don't know what's going to come through that door, and we have to assess each student as they come in and determine who should be seen first. And sometimes the students don't get it. They think they're going through McDonald's drive-through, and they don't understand that sometimes their needs might have to be set aside just for a minute so I can deal with this other student's needs. We do all of the assessment. We do care plans. We do all the same things that you do when you case manage and treat other patients in other settings. We do that in a unique setting. Okay, so Allie's going to talk to you a little bit more about some of the other services that we offer that include gastrostomy feedings, suctioning. Sometimes there's students there that require trach care, catheterization, and all of those things we either coordinate or we do ourselves. Screening, we do a lot of screening, vision and hearing screening. On all new students to the district, hearing screening is mandated by the state on certain grade levels, and we do those. We don't do scoliosis screening on a regular basis. Some districts do, but if I see a student that comes into my office that I'm suspecting may have scoliosis, I'm going to get permission from their parent to screen them for that, and if so, then refer them on. So sometimes we screen for things that we aren't anticipating we're going to screen for. And I think one of the things that as a school nurse you never really fully anticipate that you're going to be screening for is whether a student is under the influence of some illicit drug or alcohol. And we do a lot of that at my school, unfortunately. In our school district too, we're very fortunate to have a TAP program, a teenage, it's a teenage prevention and parenting program. And we have a nurse practitioner that is not an employee of the district, but she works in the district at our high school levels and sometimes, unfortunately, at our middle school levels in order to help students with pregnancy issues, with STD issues, birth control issues. But we also do the same types of education. Right now, I have a bulletin board up that I had my student put up, and it's all related to drugs and, you know, the impact of drugs. And we try to make it welcoming, not, you know, the theme is Halloween, you know, so her caption was give drugs the boot. So anyway, it's really cute. So those are some ways we get our points across, is through bulletin boards and having flyers and pamphlets available for students to pick up and take. We also deal with chronic diseases. I'm not sure, did they receive the handout on the chronic diseases?
Yeah,
okay.
I sent those documents.
So you have documents. You have documents from the National Association of School Nursing that shows you an approximation of what type of illnesses that we typically deal with on a daily basis almost. You know, asthma is a big one for us, and we have to make sure that everything is in place. And I also mentioned diabetes. I mentioned individualized nursing care plans. We dispense medications to students that need medication during the school hours. And I also mentioned that we do assessments and interventions on students who have mental health needs. We're also, in most schools, we're part of the crisis team. which means that if there is a crisis on campus, we are a responder. Each nurse in our district has an emergency bag, and when we have evacuation drills, we take our bag with us and our radios. We don't know where we'll end up having to go, but sometimes if it's a real situation, we need to be prepared to respond until other responders can arrive at our school. Our supervisor mainly is the one that works with district on guidelines, policy changes, things like that. Medicine, as you know, is always changing, so we need to be up with what's the most current requirements for how we do things. And we also serve as the school community liaison to healthcare. So sometimes we'll have a parent walk in our office to pick up their student, and they may ask us a question about, you know, where can they go for this, or what do we think of this? And we don't diagnose, but we can tell them we certainly think that you need to go be seen, and here are some options for you that might be cost effective. So when we talk about what difference do we make, I don't even think that I have enough time in a day to tell you what I believe the differences that we make in our student population are. When you choose school nursing, you have to have a passion for what you do, as you do an area that you choose to be in. And obviously, I have come to believe, and it didn't take me long, that school nursing was my passion. And I love what I do, and I think that's the key to any job that you choose, is that you've got to want to go to it every day. And I can honestly say in 18 years, I've never felt that I didn't want to go to work today. I love going to work because I don't know what I'm going to be dealing with. And it's a great feeling to be there and know that I'm helping the kids.